Have you ever wondered if the hydration mistakes you make could be slowly affecting your health? Dehydration can compromise your mental capacity, affect your digestive system, and even increase your risk of developing diabetes. Although drinking water seems like a simple act, many people do not pay proper attention to it. That's why today I want to share with you Dr. Barbara O'Neill's valuable advice to help you improve your hydration and avoid mistakes that could affect your well-being. Let's get started. Barbara explains that water is the second most important element for life, right after oxygen. While breathing is something involuntary that we do constantly, drinking water is not as well established a habit for many people. In fact, where there is no water, there is usually no human life, right? Whenever I talk to people, I ask them, "How much water do you drink a day?" The answers are usually something like, "If I drink water, my feet swell," or "If I drink water, I have to go to the bathroom all the time." These problems, according to Barbara, indicate that water is not entering the cells properly. So what is the solution? First, Barbara stresses the importance of sodium and potassium, which are the third and fourth vital elements for humans, respectively. When there is a proper balance between these two elements, the body is able to absorb water effectively. The problem is that most people do not eat enough fruit and vegetables, which are excellent sources of potassium, and at the same time they consume too much table salt. This creates an imbalance. The sodium level increases while the potassium level decreases, which causes cellular swelling and, consequently, high blood pressure. Barbara mentions that the table salt that people usually use contains only sodium chloride, as many other essential minerals are lost during processing. For those to come to her with hypertension problems, Barbara recommends the use of Celtic salt. Why? Because it is a hand-harvested sea salt that retains more than 80 minerals in its composition. These minerals help water enter the cells, promoting more effective hydration. To use Celtic salt, the doctor suggests starting by placing a crystal the size of a sesame seed under the tongue before drinking water, so that the mucous membranes absorb the minerals and facilitate cellular hydration. Now, when people feel tired, they often reach for a cup of coffee. However, this can be a serious mistake. Studies have shown that to compensate for the dehydration caused by 1 cup of coffee, at least 5 cups of water are needed. So not only are people not drinking enough water, they are actually becoming dehydrated because of the beverages they consume. Many people associate dehydration with a feeling of dry mouth, but Barbara also stresses that excess saliva can be another sign of dehydration. So how much water should we drink to avoid dehydration? Barbara suggests a simple calculation. We need to replace the water we lose every day. Normally, we lose about 1.5 liters through urine, half a liter through sweat, 300 milliliters through the intestine, and 200 milliliters through the lungs. In total, the body eliminates about 2.5 liters of water a day, which means that we should consume at least that amount for the body to function properly. It is important not to consume all that water at once, as this could lead to excessive urination and prevent proper absorption. For this reason, Barbara recommends distributing the intake of 2.5 liters throughout the day, accompanying each glass with a crystal of Celtic salt for better hydration. Dehydration can affect our body in many ways. First, it impacts the digestive system. Without enough water, the mucous membrane of the gastrointestinal tract becomes dry and thin, which reduces its ability to protect the stomach from acidity and makes digestion difficult. In addition, lack of water hardens stools, causing constipation, and reduces the production of enzymes and gastric juices necessary for the absorption of nutrients. For example, one of Barbara's patients, aged 60, had been suffering from stomach pain and taking antibiotics to combat Helicobacter pylori for over 25 years. After 4 months of treatment with no results, Barbara discovered that the problem was that this man drank almost a liter of water with each meal, diluting the hydrochloric acid in his stomach and encouraging the presence of Helicobacter pylori. When he began drinking water at the right time, between meals, his stomach wall thickened, and the no longer diluted hydrochloric acid was able to eliminate the presence of Helicobacter pylori naturally. The body healed itself with proper hydration, without the need for antibiotics. I'm going to tell you the story of a man who came to our retreat with 3 problems: chronic headaches, chest congestion, and severe lower back pain. Did you know that 75% of the weight supported by your back is supported by water? Back pain when you are dehydrated is quite common. That was the case. When I spoke to him, I asked him how much water he drank a day, and he replied that he didn't drink water, only Coca-Cola and coffee. At 46, he was already taking a lot of painkillers and his quality of life was poor. We encouraged her to drink more water, and after a week, her headaches were gone, her back pain was greatly reduced, and her lungs were clearer. 2 months later, he appeared with a big smile and a 2-liter bottle of water, saying he was now drinking 3 liters a day. Barbara also points out that dehydration can contribute to the development of diabetes, as the pancreas needs water to function properly and produce the hormones that regulate blood sugar levels. If there is not enough water, the production of these hormones is affected, which increases the risk of diabetes. Dehydration also affects the brain. Without adequate amounts of water, the brain has difficulty maintaining concentration, memory, and mental clarity. In addition, the chemical imbalance can lead to headaches, fatigue, and even mood swings such as irritability or depression. In more severe cases, prolonged dehydration can cause mental confusion and difficulty making decisions. These effects on the brain not only impair cognitive function, but also affect general well-being, making everyday tasks more difficult and negatively impacting quality of life. Many elderly people in nursing homes do not drink enough water, and this is undoubtedly a contributing factor to mental illness and brain deterioration. In Australia, there are about 1,700 new cases of Alzheimer's diagnosed every week, which is quite worrying. One of the cases presented by Barbara is a good illustration of how drinking the right amount of water can help the brain function properly. A few years ago, a 44-year-old woman participated in our program and brought her mother, who suffered from dementia. We explained that people with Alzheimer's or dementia need a caregiver because our program does not replace hospital care, but rather teaches how to create the conditions for healing. When the mother, who was about 70 years old, arrived, she just looked out of the window and did not seem to recognize anyone. Talking to her daughter, we discovered that she had not drunk water for 2 days, and due to her dementia, she said she had drunk a lot, but in reality she was not hydrated and had not gone to the bathroom for 3 days. To address this, we gave her herbs to help her bowel movements and encouraged her to drink small sips of water regularly. Many elderly people avoid water to avoid choking, but we explained to them that small sips every 2 minutes are effective. Within 24 hours, the woman was lucid, speaking and interacting normally, and her daughter was delighted to see the improvement she had not seen in a long time. Barbara warns that something worrying is happening all over the world. Many people not only do not drink enough water, but also avoid eating Celtic salt and green vegetables, which are essential sources of minerals. This, coupled with a lack of sun exposure, which deprives the body of vitamin D, contributes to water not reaching the cells properly. In addition, avoiding healthy fats in the diet leads to high carbohydrate consumption, which prevents the body from achieving a feeling of satiety, leading to binge eating. Hypertension, according to Barbara, could be caused by dehydration, lack of minerals, vitamin D, and an unbalanced diet. If you have made it this far, I want to share with you some important recommendations to maintain adequate hydration and ensure the correct functioning of the body. First of all, drinking water regularly is essential. We should consume between 2 and 3 liters of water a day, distributing our intake to avoid overloading the kidneys and to keep the body always hydrated. It is also advisable to include hydrating drinks such as coconut water, which has electrolytes that help balance the body's fluids. Secondly, it is a good idea to consume foods rich in water such as watermelon, orange, strawberry, cucumber, lettuce, and zucchini, which not only contribute to hydration, but also provide essential vitamins and minerals. You can also use Celtic salt to improve hydration. Place a small crystal of Celtic salt under your tongue before drinking water. Celtic salt contains minerals such as sodium, potassium, and magnesium, which help balance electrolytes and facilitate the absorption of water by cells, promoting more effective hydration. It is important to avoid dehydrating drinks. Limit your consumption of drinks that can cause dehydration, such as coffee, black tea, and alcoholic beverages, as they have a diuretic effect that can increase water loss from the body. If you consume these drinks, make sure to compensate for them with additional water intake. Adjust your hydration based on physical activity and the weather. In hot weather or when exercising, fluid loss is greater, so you should increase your water intake. Finally, watch for signs of dehydration: dry mouth, excess saliva, dark urine, or decreased urinary frequency. Clear or pale yellow urine usually indicates good hydration. Adjust your water intake based on these indicators. And of course, people with specific health conditions, such as kidney disease, diabetes, or heart conditions, have different hydration needs. So if you have any of these conditions, it's important to consult a health professional to adjust the amount of water you should consume, taking into account your particular needs. And now I'm curious to know your experience. How many liters of water do you drink a day? Do you already follow the tips we shared here today? Leave your answer in the comments and send this video to your dear friends and family so that they too can make the most of this very important element for our lives: water.